Hello everybody and welcome to today's Smart Inbox Interop Onboarding webinar. My name is Charlotte and I am the Transformation Change Manager here at eConsult, and I will be taking you through today's session. So during today's session we will cover the features of the Smart Inbox, what the onboarding steps look like. We will cover some process map examples, a live demo of the Smart Inbox. We will highlight some things to note, what happens next, and also what our eConsult support and information is available to you. So what is the Smart Inbox? The Smart Inbox is a purpose-built platform used for digital triage and online consultation management. It has been designed to reduce the reliance on any third-party software that has not been built for quick triage decision-making. It can help to boost productivity and foster a better working collaboration between both healthcare and practice professionals, and it can also support modern delivery of care across digital platforms and at scale. The Smart Inbox allows you to create a collaborative working environment. It enables you to search and filter based on things such as team and urgency. It has our red flag and safety features built within it. It also enables you to have both a quick view and a detailed insight view of every incoming eConsult. It has our image zoom feature built within it, and all eConsults received are automatically split within the admin and clinical folders, and you are also able to assign to users based on their roles. Smart Inbox also enables you to respond to patients the way you want without having to open any other applications. So you are able to respond to them via SMS, by email, both with and without attachments. You are able to utilise our templated responses, our two-way messaging feature, and you can also now create custom message templates. The Smart Inbox also allows you to save eConsults notes and patient communications directly to the patient record. All ICE data is displayed within the patient record. It allows you to stop the reliance on Mesh and NHS.net as delivery methods, and SNOMED codes are automatically added for online consultation. We have our eConsult support built within the Smart Inbox. This gives you instant access to our self-help and access to our eConsult operational team. And also any new features are highlighted within the Smart Inbox when they do go live. So here we have our technical implementation timeline, highlighting some key milestones to you. So initially the terms and conditions will need to be signed, and then your practice will need to submit its user details. Your staff are then able to sign up and attend a training session, and then the Smart Inbox instances and users will be created at our end. Your practice will then be turned on for dual delivery, and then you will be able to complete some internal training and testing. Once the training testing has been completed, you are able to then inform our operations team of your desired go live date, and then your Smart Inbox will be purged and set to go live. The Smart Inbox for EMIS and SystmOne Interop is accessed via the toolbar, and you will need to download and install the toolbar and configure it with your clinical system. However, if you have anybody within your team who will not be needed to save to record, we do recommend that they use the URL-based version of the Smart Inbox. Here we have a workflow example showing you using Interop. So initially the patient will submit an eConsult, and then the eConsult will arrive into your Smart Inbox queue for processing. The respective team will triage or manage the eConsult within the Smart Inbox, and then the admin team will be able to match the patient within the Smart Inbox and save it to the clinical system. And then your admin team will be able to complete any actions required within the clinical system. And then at that point, the admin will be able to mark the eConsult as complete within your Smart Inbox. We do now also have our urgent warning pilot that you're able to sign up to. So this will enable you to remove the urgent warning redirections for patients, and means that you will accept these urgent warning eConsults into your queue. So this means that you won't get patients calling through on the phones if they've been stopped and because they've triggered the urgent warning whilst completing the eConsult online. And it means that they will arrive into your eConsult queue for processing. However, they will be highlighted to you in red as shown in the image on the right. There are some requirements if you would like to sign up to this pilot, and it is that you do need to be using the Smart Inbox, and you do need to sign up to the pilot, and you can do so by emailing our practice.support email address. We also have our eConsult Lite, which allows you to have a digital space for information to be gathered and submitted directly to the Smart Inbox. eConsult Lite templates are completed over the phone for those patients who are not able to complete a eConsult themselves. And it allows your team to have a standardised approach to care navigation and also enables you to have the same format for all patient requests. And here we have an example of a workflow using the eConsult Lite template. So the patient will call the surgery, and your call handler will fill in the eConsult form with the patient details. The call handler will then submit the eLite template, and it will arrive into the Smart Inbox queue for processing. The respective team will triage or manage the eConsult within the Smart Inbox. Your admin team can then match it to the patient within the Smart Inbox and save it to the clinical system. They are then able to complete any actions that are required. And then lastly, they will be able to, your admin team will be able to mark the eConsult as completed within the Smart Inbox. So now we are going to have a product demo. So I would just like to point out, for the purpose of this demonstration, I will be using SystmOne. However, it will be the exact same process for our EMIS users. So in order to access the Smart Inbox, you can do so by clicking on the envelope on your toolbar. And this is what the Smart Inbox will look like once you have opened it. You should be able to see your name at the top right, and this is also how you're able to log out if you needed to. Here we have our search feature. This allows you to search for any eConsult that is within any folder within your Smart Inbox. And you can see that it will bring up any eConsult that is related to what you have searched. If we come along the top here, you should be able to see your practice's name. And along the left-hand side here, we have our navigation bar. If we open it up, we can see all the folders that are readily available to you. And here we can see we have the all open folder, which shows you all open eConsults that are within your Smart Inbox that are waiting to be actioned. Next, we have our completed folder. So this is all eConsults that have been marked off as complete. We have failed replies, which is all eConsults that have, if you have responded to a patient and it has not been able to go to be sent through to them, they will automatically go into this folder just to notify you that the response has not been received by the patient. We then have our clinical folders. So we have our waiting, which is any eConsults that are waiting to be responded to. We have the snoozed, which are is a option that is manually selected. So you might use this folder for various reasons, but an example would be if you were waiting on some test results to come back before you respond to a patient or book a patient in for an appointment, and you might just pop them in snooze and while you wait for the results to come through. We then have the awaiting response folder, which is if you have responded to a patient and you've asked them to respond back to you, then they will automatically go into this awaiting response folder to highlight to you. And then once the patient has responded to you, they will automatically arrive into this new response folder. So you're able to see quickly and easily that you have had a response from a patient. And then lastly, we have the triage folder. So that is all eConsults that have been triaged within the Smart Inbox. And then, as you can see, we have the admin folders, which are all exactly the same. If we come back up to all open, here we are able to see it will highlight to you at the top which folder that you have open. And if you go to the two arrows, this is our sort inbox feature. So this enables you to sort your inbox by various things, such as time received. So you can sort it from the oldest eConsult received all the way through to the newest, or also from the newest to the oldest. We also have age, so you're able to sort your inbox from your youngest patient to your oldest patient, or you could alternatively have the oldest to youngest. You can also sort it by flags, so from most to least or least to most. And then lastly by urgency, so again from most to least and then least to most. So for this demo, if we changed it from the newest to the oldest, here we are able to see that the most recent eConsult that has been received is here, and it would take you all the way through to the oldest. Next to that, we have our filter inbox feature. So this allows you to filter your inbox upon team. So you're able to filter it for which eConsult has been triaged. So for example, all eConsults that have been triaged for the GP, you can filter your inbox through that. Or you can also filter by urgency. So you're able to select unassigned, 24 hours, all the way through to 4 weeks. So if we come down to the eConsult itself, this is what the eConsults will look like when they arrive into your queue ready for processing. And as you can see from a quick glance, you're able to see what template was used, the patient's age, that it's waiting to be reviewed and triaged, and also the date it was received and the time and which template was used. In this case, you could see it was an admin template. If we click into the template itself, this is what the eConsult will look like once it has been opened. We can see at the top the date, again, the date it was submitted and the time, the name of the patient, their gender, their age, and which template was used is highlighted in large writing here. If we look at to the right here, we're able to see that the patient has not been matched, and this is also notified to you here with this small icon with the little person with the amber warning next to it. So if we click on here, we can see here it will bring up our eConsult patient identifier on the left here. However, there have been no suggested matches for this patient. So in this instance, if you still needed to save it to your patient's record within your clinical system, you would do so by exporting it to a PDF, and then you'd be able to manually upload and save it to your patient record. However, if we scroll down, we're also able to see that this patient here has also not been manually matched. So if we click on the patient here, we are able to see that there has been one suggested match. So if you are happy that this is a match to the patient, you can do so by clicking select match, and you can see here it'll bring up a toaster. The patient has been manually matched via SystmOne, and you can also see that it has gone green here. You can also see that it's notified you here that the patient has now been manually matched, and also the small icon has now been removed from here. Once you have completed with the eConsult and you want to save it to the patient record, you can do so by pressing Save to Record, and it notifies you that it's saving. And once it has been saved to record, a small toast will arrive on the left-hand side here, notifying you that it has now been saved to the record. So if we just go into our clinical system, we should be able to see that it has now been saved into our patient's record. So if we just make sure that we've got the right date of birth for the patient. And if we open up our patient in the clinical system, you're able to see that the eConsult has now been saved to the patient's record. And you can also see the date and time that it was saved and who it was saved by. If you wanted to respond to the patient, you are able to do so directly within the Smart Inbox, and you can do so by clicking this respond here, and this will allow you to respond to the patient. You can do so by free text, and you can also utilize the templates that are readily available to you here. As you can see, if you scroll through, it will bring you up a preview. And once you have found one that you would like to use, you can add it in, and you can also amend this as necessary. You are now also able to save any custom templates yourself, and they will be saved within your personal folder here. And you save them by clicking the Save as Template icon here. If you are responding by email, you can attach a file up to 8 megabytes. And you will the email address that is inserted is the one that the patient has completed the eConsult with. And this is the same as for the mobile number as well. However, if you did want to add a different mobile number or email address, you can do so. If you wanted to allow your patient to reply once, you can do so by clicking on this toggle, and it will send you the patient a notification to respond to you within 7 days by clicking a link. If we come over to the right-hand side, you're able to see our signposting section. This allows you to signpost the eConsult to a particular team member. So as you can see, we have various roles inputted. However, there is also the other option, and you can also utilize the comment section. You're also able to signpost the urgency. So they go all the way through from 24 hours, all the way through to 4 weeks. The type, so the type is automatically selected by the automatically selected depending on which template has been used. However, you are able to change this if need be. And lastly, you can update the response. If we scroll down, you're able to see the comments and activity log. So you're able to see which comment was left and by who, and the date and time it was left by. And then if you go into activity, this is all activity that is in relation to the eConsult. So here you're able to see that I saved the consultation and communication to a clinical system. And also you're able to see that I manually matched the patient within the clinical system. And if you go to all, that shows you all activity in relation to the eConsult itself. If we have a quick look at the eConsult itself, we can see from a quick view that there are some answers that may have fit the triage decision. This is highlighting to you that there are some amber flags located within it. And if we scroll through, you can see that any eConsult, any answer that has this blue icon is notifying you that these answers have been answered by the patient via the free text box. And here you can see from a quick view which answers may need a bit more of a quicker attention. So it's highlighting to you, and if there are any red or amber flags located within the eConsult itself. If we scroll down to the bottom, this is if there were any images attached to the eConsult, this is where they would be located. And also if there were any clinical incidents related to this eConsult that you felt could be reported, you can do so by clicking here. You are also able to leave feedback directly within the Smart Inbox by clicking on this icon. And if you wanted to access our help that's readily available within the Smart Inbox, you can do so by clicking this icon, which would bring up this, where you're able to send our operations team a message, who, as you can see, typically reply very quickly. You can also search for help yourself. And lastly, it would highlight to you if there are any if there has been any new features updated within the Smart Inbox itself. So that concludes the live demo of our Smart Inbox. So we can now go back to our slide deck. So here we just have some Smart Inbox product considerations for you all to bear in mind. So all users are managed by eConsult itself. So if you do find that you wanted to add or remove any users, you would need to contact our operations team to do so. Unfortunately, we are unable to delete individual images, and any images will need to be deleted by eConsult. So again, you would need to get into contact with us to do so. At present, you can only assign eConsults to a specific role and not an individual. And at present, comments and signposting are not pulled across into the clinical system. And you are not able to customize the signposting section drop-downs. So here we have some frequently asked questions that we will just cover. So how much does the Smart Inbox cost? So the answer to this is nothing, as it is included within your current package. How do I get my eConsult Lite URL? So you're able to get access to your eConsult Lite URL via our operations team. So you can do so by emailing our practice.support email address. Do we have to use Mesh or email delivery as well as the Smart Inbox? So the answer to this is no, and we do really encourage you to use our single delivery. So all eConsults are received directly into the Smart Inbox for processing. How do I get my eConsult ID and message ID? So this is available to you on the eConsult itself. How do I add or remove users from the Smart Inbox? So again, this needs to be done directly by our operations team. So you will need to contact the email address to do so. Can I share message templates with my practice/PCN for custom communication templates? Unfortunately, at the moment, we are not able to do this. So all message templates that have been saved to the personal folder can only be shared, can only be utilised by the person themselves. What happens if an eConsult fails to be delivered to the Smart Inbox? So we haven't actually had an instance of this happen yet, but if it were to happen, then it would be received via your email, the fallback email address. And lastly, what should I do if there isn't a patient matched for saving to record? So if you were to find that a patient has been matched when you are within the Smart Inbox, you are able to export it as a PDF and manually upload it to your clinical system. So what happens next? So the first thing you'll need to do is get access. So you can do this by downloading the eConsult toolbar for the users that will need it. So these will be the users that will need to be saving directly to record. You will also need to share the URL with your team, and then you will need to start testing and logging into the Smart Inbox. Secondly, you will need to start testing and training within your team. So you will use copies of real but old eConsults in order to test the Smart Inbox. You will then need to design your new workflow and processes, and also update your standard operating procedures. And then you will lastly need to communicate the new way of working within your team and hold some internal training for this. And lastly, you would need to get ready to go live. So you would need to decide on a go live date initially. Lastly, contact our operations team if you would like the old eConsults cleared from your Smart Inbox before you do go live. And lastly, we have our eConsult support and information that is readily available to you. So you are able to contact our operations teams who are available between 8 and 8. You can do so by accessing their live chat, or emailing their practice.support email address. And we do encourage, if you have any problems, you do use the email address. And some other resources that we have available include our eConsult Help Centre, our service alerts, which are available via email or SMS. You can have access to our product roadmap, and also we have some webinars on demand available to you. And then lastly, the Facebook user group that we do encourage that you do join.